like you don't feel weird talking about your elbow, so
Yeah.
you shouldn't feel weird talking about your pelvic floor. So, and that's the stance that all of the whole staff, like, so I feel like we talk about it so normally,
Yeah.
and I feel like that helps people feel comfortable talking about their pelvis and their pelvic dysfunction, whatever it may present as. And I feel like just making it not a taboo subject is so important.
Right. You came to our consultation group just, was it last week or 2 weeks ago?
Yeah.
And it was funny to me how we all had pie and we're eating pie, and you break out your model, which I guess you didn't bring in today, but your pelvic, your literal your pelvis bone with all the muscles and everything.
Yeah.
You're talking about the pee and poop, and we're all just sitting there eating lemon pie. But
perfect.
it felt like exactly what you're talking about maybe trying to demystify or normalize these things that can even be part of the healing.
Yeah.
And I remember you saying in our meeting of like, that sometimes when people come in, you can sometimes tell the level of their pain even just by the language that they use when they talk about their genitals or when they talk about that area. Can you speak to that a little bit? Because I thought that was fascinating.
Yeah. Sometimes people talk about their pelvis in euphemisms.
Yeah.
Some people, all of the female genital organs would be internal. So some women don't look at themselves. They've never seen their own vulva. And sometimes they have euphemisms for their body parts or sexual function in general.
Like even saying the words makes them feel uncomfortable. So they dodge it because partially maybe it's been a place of shame or thing they don't like to think about.
Yeah. And I feel like and some people don't like to talk about these subjects with anybody. So it's hard to say I'm having pain with sex with my partner. Some people would say I have pain when I have my relations, and they would say something along the lines that's or it's perfectly fine if that's how they want to talk about it. But then the clinician is starting to think, okay, so what sort of things, how is their relationship with their pelvis, and why are they using with euphemisms, and how does that play into their treatment? So are they using euphemisms because they're not comfortable with their body, or they're just not comfortable talking about it with me? Because those could be two different things.
Right.
Yeah.
Right. But it's definitely can be uncomfortable.
Yeah.
And they're in pain. Right. What do you run them through? What's your process? Yeah.
So part of what we do is ask them what they have been through, their history, and we do ask for consent for the questions that we ask to make sure that they're comfortable answering these questions. And part of the reason behind that is that helps them become more comfortable and at ease. And in time, if they are ever willing to tell us about more about their pain or their history, then it's all on their court. But with that, I guess that's what I was saying.
Yeah. So, so you ask them some questions, and then what happens next for them? What can you just kind of curious of, especially if people who have never heard about pelvic floor therapy or what's involved, about just kind of running through of like how that works. What do you guys do for, let's say, a person coming in and they have trouble with I forget what the term was about urinating and may not be able to control their muscles too well, but down there.
Okay, so yes, we start with the history. And then whatever their history is, it helps clue the clinician on what to check. So, but typically on the first visit, we're checking anywhere between the rib cage and the knees. In subsequent visits, we may be looking higher or lower. So that would include pelvic girdle muscles, which is inner thighs, gluteal muscles, etc. And then your abdomen, your back, your diaphragm and how you breathe, and your pelvic floor. So the pelvic floor is an internal examination. We do get a consent with that to see what they're comfortable with. But the internal examination is either 1 or 2 fingers vaginally and just 1 finger rectally, just depending on what the clinician feels is appropriate to check in that initial evaluation. We're checking to see if the muscles have a lot of restrictions, if it's too tight, if they have like a lot of length and they need more strength. We're also checking to see how well they contract, relax, endurance, any of like it's a muscular exam, and we also look at the nerves as well. But to make people feel comfortable through that, yes, consent is a huge one. We let people know things that are going to happen before it happens. And they also have control of the room. Like if they would like more lighting, if they would like it a little bit more dim, just to make them feel safe. And the way the room is laid out as well, they don't necessarily feel trapped. We're not blocking the door, so they can feel they can leave at any time. And yeah.
You guys are really sensitive to this being something really vulnerable for people to talk about.
Yeah.
Or to be examined about. And I can hear that with like the lighting, the way you guys are asking consent and questions that, here their body in a lot of cases has been on like high alert or tense, especially around these areas, and I'm already kind of hearing of like the ways that it's like you're trying to create an atmosphere of safety so that you can actually maybe address something. I imagine that part of the struggle with even helping somebody, is just even helping them feel comfortable to get in the door and to follow through with treatment that they need. I see this in a different way in therapy all the time where, especially with like couples issues, is like people, they feel so uncomfortable actually addressing it, and like they don't want to know. They don't want to know what's going on. They don't want to actually find out that it's something that needs help or that's something that they're going to need treatment for. And I imagine it's a similar kind of situation for people in their pelvic floor, is that a lot of times people don't want to come in, even if they're in pain and it's causing them a problem. They don't want to do it because they don't want to either figure out that it's something that needs help, or they don't want to be seen, or they feel embarrassed in some way. And so I can hear even in that of like how sensitive you guys are to that experience of people coming in and feeling really, Yeah.
I know people use the word empowered a lot these days, but part of our goal is like giving people the tools to speak up for themselves, especially because like this is such a vulnerable topic, and it is a balance between knowing how to normalize it for the specific person and what their own boundaries are. But part of that, and we feel like that is part of healing and making sure that they know that is their body part. And I like the word you use is safety, because that goes align with a lot of pelvic pain that we see. So the nervous system, I'm sure you know, the nervous system is always trying to seek some safety. And with chronic pain, the safety alarm, like the danger alarm, is a little bit it could be too heightened. It could be too sensitive. It can detect things that aren't necessarily painful, and it can conceive them as painful. And with the pelvis and the pelvic region, if that subject is taboo to you, what is the brain going to perceive it as? So, and that's why we love working with therapists as well, because making sure the brain is healthy, the mental health is healthy, it goes in line with pelvic therapy.
Yeah. So I'm going to ask you kind of a general question here, but why do people have problems with their pelvic floor? I can think about, for example, somebody who, let's say they're a pitcher and they've, torn something in their arm or something like this, a certain kind of specific trauma that might be easy to point to because we can see it, right? But what why do people have issues with that whole musculature
Mhm.
region? I remember you describing it as kind of like all these complex different muscles. It's not like
Mhm.
one thing, right? It's not
Mhm.
like one muscle. But why do people have issues?
Yeah,
Yeah.
it can be a lot of reasons. First, there's childbirth, where most people see pelvic floor physical therapy as pregnant postpartum therapy, which it is. So that is trauma. It's like 9 months like your pelvic floor carrying something that's growing inside of you, and then your abdomen is now it can't have the same contraction that it would be without being stretched out. So, and it also changes your posture. So it could be purely musculoskeletal. Um, for musculoskeletal reasons, it could be what if you had like a groin strain? The groin muscles do attach to the pelvis, so it can talk to the pelvis in
Hmm.
that way. So there can be musculoskeletal reasons. There's other reasons why people would experience pelvic dysfunction. One is if they have a chronic condition like endometriosis, that causes pain. And it could create some muscle guarding. So the muscle guarding could then become like a pelvic floor muscle spasm and create a whole host of other issues. That's not necessarily endometriosis, but it was caused secondarily to endometriosis.
Can you say more about muscle guarding?
Yeah.
Yeah.
Yeah, I like to think about like the pelvic floor as it muscle guards in the same way if I think two reasons. Like, for example, if you're going to get punched in the gut, you see it coming and then you brace, right? So that's guarding your muscles to prevent pain, which is somebody punching you in the gut. But the pelvic floor also has special innervation. It's an autonomic system. So it helps you, so you're not like peeing yourself or pooping yourself. And other reasons as well for like sexual function. But because it has autonomic fibers in it, which is fight and flight, rest and digest, if you're in a heightened state, then you're going to also muscle guard. And I like to relate that to people who grind their teeth. If you're grinding your teeth, it could be because of stress.
Yeah.
The pelvic floor, people don't necessarily see it. So it's hard to tell if they are muscle guarding throughout the day, secondarily to a heightened system.
Okay, that's really helpful. So you go muscle guarding has to do with this kind of chronic tension that we do to brace for sometimes like what we think is going to be like a punch to the gut kind of situation, or protectively, like I always have to be in this fight or flight or protection mode. And that does something to the pelvic floor too. It's not just a punch to the gut. There's some version of that the person might be just emotionally contracting those muscles out of some kind of fear. And if I'm understanding you right, and that leads to like some kind of weakness in the muscle.
Yeah,
Is that what you're saying?
that can lead to weakness. So muscles are fibers, contractile fibers, right? So they kind of go together like this, contract, and then they relax, right? So if your fibers are in a contracted state, how much more contraction do you think it can have?
They're not moving anywhere.
Yeah, they're not, and then therefore they're weak. So that kind of debunks the myth of if you're weak, you need to continually contract. That's like the Kegel myth. People can have stress urinary incontinence, which is urinary leakage, and their muscles are too tight. So if they're going to a specialist and they're just saying, oh, just do your Kegels, that might not be the correct thing to do.
Whoa. Okay, wait. So say more about the Kegel myth. What's
Yeah.
that?
Yeah. We're more than just Kegels. We're more than just Kegels.
Is Kegel that's a specific muscle, right?
It's an exercise.
Exercise. Okay.
So
okay.
it's a pelvic floor muscle contraction.
Yeah.
Yeah. So Kegels are pelvic floor muscle contractions. And oftentimes people, typically for stress urinary incontinence, people would think, oh, I'm leaking. I just need to contract my pelvic floor muscles so nothing can come out.
So I can build the strength down there, or I can make the muscle stronger.
Yes. Yes. However,
as if the muscle is too relaxed. Is that what you're saying? Yeah.
Yeah. Like, as if the muscles are too relaxed and they don't have the strength to contract to prevent anything from coming out. However, on the flip side of that, your muscles can be weak through the opposite reasoning, meaning they're too tight and they cannot contract any further.
Okay, you used like a fist metaphor.
Yes.
Can you say that a little again? I'm forgetting what that was.
Yeah. So, how I like to think of a pelvic floor muscle contraction is if you're making a fist, this is full contraction, and then if you open your hand, that is the lengthening portion.
Mm-hmm.
So if your muscles are continually in the fist position, a contracted position, and let's just say you've been living here for years, it can be fatigued from holding on for so long. You can see like there's some ischemia. Your hand starts to become white, less blood flow to the region, and you lose strength because how much can you contract further when it's already full contracted?
Yeah.
And that goes with the length tension relationship that I was explaining earlier with the muscle fibers. If you can fully relax it and lengthen your hands, you then now have all the muscle fibers to then close your fist or contract your pelvic floor muscles.
Mm-hmm. It's kind of like, I'm thinking about like potential energy kind of analogy there, where it's like if the weight is way up at the top of the pulley, it has all that weight to drop, right? And to lift a load, let's say. But if it's already down at the bottom, already contracted, it can't really lift any weight at all, you know? But your muscle like that, if it's already contracted, it can't be in a position to like hold a load because it's already firm. It's already, doing, but it's also being continually like exhausted. I'm picturing like being in a constant like leg sit or a constant like plank exercise. Yeah. And this is kind of where the pelvic floor is. And then we tell people do Kegel exercises. And this is kind of the, what I can imagine from your perspective can be kind of like maddening of going, we don't need to keep tightening it over and over. Is this kind of what you're saying?
Yes. Yeah. We don't need the Kegel would be the opposite of what you should be doing. You should be learning how to lengthen, relax, and then retraining the muscles of how to properly contract and relax appropriately. For example, you need to relax your muscles when you urinate. You need to relax your muscles when you defecate. And then for sexual activity, you need endurance, you need strength, you need to be able to do it, have muscle contractions quickly and full relaxations too. So it is like any other muscle.
Right. So if you're at the same time that you're trying to, do one of those three things, either have sex or pee or poop, at the same time, you are in a state of, let's say, high anxiety or stress, or there's just almost a habitual holding and reflexing of that muscle from a past trauma, let's say this kind of protective gut punch thing that you're talking about, it's going to make all of those things, difficult in some way. And again, it's probably easy to think, oh, that's, those people over there who have some kind of problem. But I always like to think of these things as some kind of spectrum of going, there's some way that probably all of us either carry some kind of trauma in that region or experience or even shame, that can mess with the way that our muscles are able to relax so they can be strong.
Yeah.
This is kind of, yeah. Mm-hmm.
Yeah. I love how you said that because it can really be shame or trauma from even childhood. I think I gave the example of when little boys go to school for the first time and they're like getting erections, it's not socially acceptable to have erections in public, right? So then you're telling your body to suppress something that is very natural. And they can have erections from not even like anything sexual. It's just like a little antenna of like their emotions.
Yeah, right.
So, and then suppressing something that is a natural bodily function and telling them that it's not okay to do this in public, where this is the society that we live in. So how does that fit into their pelvic function as an adult? Did they carry the emotional attachment from that part of their life into adulthood? Is that part of their treatment? And that's where a mental health therapist can come in, and then we'll just tag team like the nervous system component of it, down training and pelvic floor muscle function. And
right. And I mean, okay, so to go back to that thing of the messages that maybe we receive about, our, sexual areas, I can imagine two things there. One is a neglect of it not being talked about. And whenever I have, let's say, an erection or some kind of even desire, there's nowhere I can really turn and feel like there's an acceptable place to express this or feel it or normalize it in some way. I think about the fact that, there's very little like even seeing other bodies, they used to be like in the locker room, for boys at least, you'd go, oh, there's another penis, there's another guy that's my age. And it normalizes something where it even if it's not talked about, it's at least experienced of, there's something normal here. So I can think of that with neglect, but then also on the other side of shaming, of this almost overbearing kind of thing. And this kind of matches parenting styles from our perspective of going, there's one which is more of an anxious parenting style, which is preoccupied, like close the ears, like, I don't want to hear this, no. So as soon as my kid becomes sexual, which can be young when they start to have questions and explore, it's like, I don't even want to pay attention to these signals from my kid. And then the kid feels pretty lost in that, On the other hand, I can imagine it being kind of like, the situation where it's overbearing, let's say traditionally like let's say a strict religious environment where there's really strict ideas and shaming ideas about what it means, and I think both, I wonder, how much that ends up shaping the nervous system around those muscles about anytime they feel some kind of arousal or pleasure, that they what might they be doing differently with that muscle just by having that strain in that area.
Yeah. I love how you bring this up because like I said, the pelvic floor has autonomic function in it, and our body is made up of different parts, but we are a whole one person. And the pelvic floor does talk to the brain, and like it does respond to what the brain thinks. It does respond to emotions. So with shame, anxiety it could come with pelvic floor muscle guarding. And pelvic floor muscle guarding, if it's in that state for a long time, can present itself with all the symptoms that we had been earlier talking about.
Yeah. Yeah, they talk even about to get outside of the sexual function of, defecating, where they talk a lot about this with OCD, of, when usually OCD is traditionally in more analytic communities associated with like potty training and this idea of don't make a mess. And when you make a mess, it's a really big deal. It's going to make mom and dad really anxious or angry. And so they learn to constrict, they might get constipated. Those muscles might be really tight. And then you go, what happens long term when they're holding those muscles in that position through their formative years of development? How much does that not just affect their mind about the way that they learn to, let's say, be incredibly perfectionistic? They can't let things go, literally, but at the same time, how much does that affect their pelvic floor in the way that they're experiencing pain even later in life? I think that's just so good to think about, like, man, the ways that our bodies are literally formed by some of our relational, emotional experiences, and ends up coming up in these kind of heightened moments where they finally go, I can't take this, I'm in pain, and I need to do some kind of physical therapy to figure this out.
Yeah, and by bringing that up, how we urinate and defecate, it is a bunch of reflexes, and training those reflexes or learning those reflexes in a certain way can shape how we urinate and defecate as an adult as well. So if we're constant, if it's not a good motor pattern or a healthy reflex, then just retraining all the loops is part of physical therapy. like for example, just period. That's yeah. We need to do a lot of retraining of how to have a healthy, healthy bladder habits, healthy defecating habits, and that is a lot of the nervous system work, and it is a lot of pelvic floor physical therapy. And I know that if people are coming in with emotional stuff that they've been dealing with as a kid, like how you were explaining with the constipation, holding everything in to control, then that's how we work with therapists as well.
Yeah. And I hear that. At the same time, I go, you are doing something emotional with them as well. You know, like, you know, for you to literally pay attention, ask them, touch, feel, you know, you're doing something with their nervous system to relax it as well, something needed. And that doesn't just happen through talk therapy. You know what I mean? Like you're literally intervening in a nervous system way, but you're just, you know, doing different exercises with them, you know, helping them to notice a certain sensation. And I imagine that it does stir up things for them emotionally, you know, like as they come in, even though, you know, we want to say, okay, it's physical therapy. It's not such a clear line. I mean, you're talking about like a, you know, a very, very nervous system based thing. There's not maybe usually something just wrong with your musculature structure, even though sometimes that can be the case. A lot of time the pain that come from is this tightening of the muscle that happens from the top down, it sounds like, right?
Yes.
That even something like childbirth can be this protective thing where maybe the body, you know, in a perfect state, maybe ought to be recovering in a good way, but then their body, for whatever fear, if I'm understanding you right, might kind of be, you know, holding on to the fearfulness of what it's going to feel like or the trauma of it in some way.
Yeah. Like for example, the childbirth example so your pelvic floor, I believe, can stretch up to 250% with childbirth. And that is
huge.
That's huge. That's a lot of percent.
Yeah.
And with that there can be trauma to the tissues. And if there's trauma to the tissues, then we go back to the punch in the gut analogy. What happens when you're hurt? You tend to muscle guard, and that can create some tension in the pelvic floor. And so I like how you said the top-down analogy or the top-down method, but it can also be bottom-up, where I hurt my hand, I get a cut, then it travels through the spine and then up to the brain and then back down. So it could also be the loop as well.
Right. So what are some of the like life transition reasons? I mean, one of the things you're pointing out is like childbirth. But it's like for people, it's not like they just decide one day I ought to go to pelvic floor therapy, right? There's usually some issue, whether it's, I'm imagining, trying to have a baby, so they're becoming more sexually active, or it's becoming more of an issue, or they've just had a child. But what are some like the main things that people, like the life events that happen that lead somebody to go, I have to reach out?
So sometimes people feel like they have to pee all the time, and that could also become painful. It could feel like a UTI, and it can also feel like you have prostatitis without any bacteria present. So imagine you have this UTI feeling, you have this intense painful urge all day, and all you need to do, and you need to work for your job, and you can't concentrate. So that's one thing that people come in for is the UTI-like feeling, or prostatitis-like feeling. So that's one. And another one is if they are constipated, and that in itself is getting in the way of life. If you're not having a bowel movement for days, that does not feel good. No, we put I don't think we think of like how how grateful people are if you have a good and
Uh-huh.
healthy bowel movement, because I feel like we take it for granted, because people who can't poop, it could hurt, it can make your whole body not feel good.
It disrupts your whole
Yeah,
life.
it disrupts your whole life. And what if you are having bowel movements, but they're like rock hard and they hurt coming out,
Yeah.
but you don't have any fissures or hemorrhoids or anything else? Then that becomes us as well. So you can be going to the doctor, asking them if to get checked out, but there's nothing colorectally that's going on. That's when we also come in.
Wow.
Yeah.
So this is where I wonder about this. I think this is a general tendency that we can have when we have an issue like this. One is that we want to strong arm the issue into, for example, I'm going to take a suppository, or I'm going to take a muscle relaxant, or I'm going to force the issue. And what are some problems with that? Because I can imagine and this happens all the time. I'm just going to take a medication, or I'm having this issue, but instead of let's say understanding what the issue is and thinking long term about why it's there, what we need to do to actually get the body back in tune with it, I'm just going to do something to do a quick fix because I can't afford to take the time to do this or whatever. But what are some issues that you run into there with that?
Yeah. I'm glad you brought that up, because sometimes we do suggest using some sort of muscle relaxant or suppository. However, if you're not going to physical therapy for, let's say, given the constipation issue, having a bowel movement is a motor function. So if you're just using a muscle relaxant to relax the muscles in order to have a bowel movement, how long do you think you're going to be trying to do that for if you're not teaching your muscles how to lengthen and relax? And are you going to create further harm to yourself if you're just learning to force your poop out and you're not learning how to do it through relaxation? So that it can help momentarily, could be just a band-aid, but B, you're not really learning the motor functions of how to do things properly to prevent more issues in the future.
Yeah.
Yeah.
There's, I think there's just a larger tendency there that, we can get into where, again, it's sometimes we don't want to know what's going on, and we'd rather just take a pill or do something. And then you get stuck in the same repetitive cycle over and over again. I was just talking to Giancarlo from the Vital Brain Health. I think it's Vital Brain Health. But he was talking about the same thing with ADHD, where you go, I just want to take a medication so I can focus. I just want to take caffeine so I can focus. And as much as I think I want to have understandable sympathy for what it's like to be pressured and to feel like there's I don't have time or money or energy to figure this out. You go, man, like you said, how long can I afford to do this? How long can I afford to keep crossing my legs because so I don't pee myself or have to do something to that's painful. At some point you got to go. Maybe I'm afraid of actually being taken care of with this. Maybe I have some kind of feeling about actually reaching out and having somebody look at this or help me with this. But I think it's if our goal is to grow and to be the best version of ourselves, I think that involves having to confront some of those things, the ways that maybe we feel shame or we feel embarrassed. In order to get the help that we need.
Yeah. And we do treat pelvic floor dysfunction, but we do advocate for just healthy people. And I like going about it and educating people that it shouldn't be shameful to talk about, because that in itself makes it hard for people to reach out for help. And learning that this is not a shameful thing to talk about. You can be comfortable talking about it, especially with a health provider. That's part of what we really want to bring, just so that we can have a healthy pelvis and a healthy person, and that in turn creates healthy communities, right? So, and attacking it from different angles, making your musculoskeletal system really strong and healthy, and making your nervous system being able to regulate for whatever you need it to do. And this just taking care of yourself with a healthy lifestyle is just so important to us. And that is pelvic floor therapy. So yeah, I do think it all starts from educating and having people know that this shouldn't be something shameful to talk about.
And I'm a believer that like often the things that we're most scared of or ashamed of are the things that the places where we need the most healing and care. You know, those are the things that we want to confront in our lives, you know, and sometimes you don't know it, but like the thing that you actually really most want in your life is behind that space, that behind over that hurdle of the resistance that you feel. And I think this is one of those cases where you don't know just what it'll feel like on the other side, or just what the actual goodness that you'll have for yourself, or the healing that you'll have for yourself is on the other side of something like that, until you actually make a step like that. For example, how will you be able to talk to your own kids differently about their own sexual health, or you know, about their whole anatomy? How will you be able to confront those things in a healthy way with them because you've experienced care there? This is a wonderful way. I think that we sometimes don't know just how much it's going to help until we actually reach out and take care of the thing that we're maybe most scared to take care of.
I love that. And I really do think doing things that you're scared of and that would help you help you in a healthy manner, it's part of life. It's part of life. It helps us grow. And doing this, we are talking about pelvic floor physical therapy, just understanding what your body is doing, and how it functions, and your body parts. That's just one more step to healing. If that's what you were having trouble with, that is part of healing.
You know, it's like exposure therapy is maybe a good framework to think about this too, where there's some people who kind of argue that all therapy is exposure therapy, where, you know, that what we're really doing is we're shining light on something that we're scared of long enough to help the person relax and go, oh, I'm still okay. I can imagine that's the same thing that happens in a micro sense when you put pressure on a pelvic muscle and there's a resistance, and then you feel it relax. Right? You're observing it. You know, you're observing it. You're putting pressure on it, and then the body just goes. It first tightens up maybe, and then it goes. You know? And isn't that what healing is in general? It's like there's this shining of the light on the thing so that it relaxes. You know, and I think about that with all kinds of things, that there's a way that I think in culture today, there's an opposite sense where it's like X, Y, and Z is toxic. And so I'm going to cut that off of my life. And I don't want to have to, and so I'm going to have good boundaries, and I don't want to expose myself to that because it's going to hurt me in some way. And I have to purify myself, you know, like, so for example, these people don't agree with me, whatever it is, politically, or this person was nasty to me, this friend was nasty to me, so I don't want to talk to them anymore, and I'm going to cut them out. And we think, oh, I did a good job because I was, you know, being good about boundaries, or I now I can not have things disturb my peace. But healing in a good way is going, what is it in me that is so uncomfortable, and can I actually come close to that and feel some kind of release or understanding or goodness there? And I think this is like such a physical way that you're encountering some of the deepest shame that people have, that they've ever had in their lives, you know, that has created so much. It's not just in their head, let's say, it has become a musculature expression of something that's difficult. And not just emotional pain, but physical trauma, like childbirth, you know, where it's incredibly, for some women, incredibly scary, you know, and overwhelming. And to go back and to address those same wounds, literal musculature things, might be one of the hardest things that they do, But again, it's like that's where the healing is too.
Yeah. And I like how you were talking about the muscles, and we call it manual therapy, like when we're putting our hands on somebody and then the muscles, quote unquote, releases.
Yeah.
I like to think that that's your nervous system. Manual therapy is talking to your nervous system in a way to help it acknowledge that it's safe. So we're just we're just like the vehicle to get you there, but your body really is doing the work. When we're doing manual therapy, it is talking to your nervous system, and your nervous system then registers as like, okay, this is now safe.
Yeah.
So
well, it's your nervous system talking to their nervous system, like what we talk about, like, in interpersonal neurobiology, there is that they are tuning into the way that you have learned to become safe about these things. You've learned to feel okay and congruent with this thing. You're not afraid or squeamish. And they inherit that capacity by your touch or by the exercise or even by your voice. They're inheriting that from you. And then they're able to grow that ability inside themselves, So there's like it's not just your hand, right?
Yeah.
It's your whole body able to go, I've been through this before. This is so normal for me. I'm okay doing this. And you're going to be okay too. And then their muscle relaxes, right?
Yeah. I love that, because I feel like it's an art. I feel it's definitely an art form. The patient-client relationship, especially in this setting. And just how you present yourself to a patient, your interaction, how your rapport all goes into pelvic floor physical therapy.
When you say art, I think it's like a human-to-human connection that is the vehicle that you're being tuned into there in the kind of artistic or like intuitive way with them.
Yeah. And I think it's really special. And just because somebody not everybody is going to like how I present material to them, and there is a pelvic therapist for everybody. It is a relationship. It's what your body interprets as safe or like can feel safe in, and that's what we really strive for, is like how they're having the patient feel safe when they come into us. Do they feel, we want them to feel safe in our environment. We want them to feel safe with our presence. And with like the manual therapy, we want them to feel safe, their body's nervous system to respond positively, to tell themselves that their body is safe. And that with exercises too. It's all about safety. Yeah.
That's really wonderful. And then you guys are, you guys have been in Pasadena, but you guys are now moved down to Highland Park.
Yes.
Right? Okay. So when is that happening? Highland Park?
We're so excited about this. This is happening we believe we're going to start treating there on April 14th.
Wow. That's
soon.
Very
soon. Very
and
soon.
And what will that space be like? And what will it do for you? Because I'm guessing as you kind of are redesigning a space or rethinking about it, you've had a chance to kind of go, okay, act 2, what are we going to do this time? But what are you hoping for with this space that'll help you to do?
Oh my God, I am so excited about this. So this space is ours. It's like standalone, the pelvic model.
Yeah.
And with this, we are still treating pelvic floor dysfunction with pelvic therapy, one-on-one with doctors of physical therapy, etc. But with this space, we really want to help the community, learn about their bodies. We're going to hopefully host workshops to spread the word that you can be healthy in your body, and the pelvis is normal, and we can talk about these things in a safe space. So we're looking forward to helping with education in the public, helping them feel comfortable in their bodies. Hopefully we get more programs like yoga and Pilates.
Yeah.
I don't know, just a thought.
Yeah. Some other kind of neighboring disciplines there to kind of, create, because like you said, it's like these things are all kind of related, and what a cool thing to have space to be able to help people in
Yeah.
different ways.
Yeah. Yeah. And all pelvic therapy focused. And we would love to have you
Oh
as
yeah. Yeah, of
well.
course. Yeah. I need an invite. Yeah.
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 Yeah. So I think it's going to be pretty cool. We just want, I feel like we're all pretty communal at the pelvic model, and we just want everybody to be happy and healthy,
Hmm.
healthy pelvises.
Yep. Yeah. Well, I really appreciate it. I appreciate kind of the work you do. And then also I just think it's so important. It's like, if I picture in my mind what it would be like to go to a physical therapist for
Mhm.
pelvic issues, I pictured that it could be cold and it could be kind of mechanical and scary that way, like kind of like being in like a fluorescent doctor's
Yes.
office kind of thing. But I mean, just the way hearing you talk about it, so important. And I hope, I can't imagine people can't pick this up, but like just how tuned in you are to what it means to a person
Mhm.
to come in for help like this,
Yeah.
and how essential that is to actually their healing.
It is.
So yeah, I just appreciate that. Yeah.
Thank you.
Yeah.
Thank you. Yeah, we want you to feel cozy.
Mhm.
We don't want it to be to lay on a cold paper on
Yeah.
a bed.
Right. Uh-huh.
That doesn't make you want to like
Relax.
relax.
Yeah.
Yeah.
Right. Totally.
Yeah. So environment is important to
It
us.
is.
Yeah.
Well, thank you. Okay. So look for that invite. Yeah.
Yeah.
That'd be great.
Yeah, of course.
Cool. Well, congratulations. And yeah, good luck in your new space.
Thank you.
Yeah.
Thank you.